How are you, ma'am? I'm also good. Thank you so much for joining to our channel and giving your precious time and sharing the knowledge. So, yes, ma'am. As I can see, many of the students are curious to know about aquatic therapy and how it works. So, I thought, why not to conduct a live on it? So, yeah, so guys, we are having Dr. Chandri Mehta ma'am with us. She is practicing aquatic therapy since last 15 years and she is also a founder and director of Aqua Max Rehab and Wellness Private Limited in Mumbai. After earning her further education in IATF Switzerland, ma'am pursued her passion for bridging the gap between aquatherapy and conventional physiotherapy. And with her innovative techniques in the field of physiotherapy, ma'am aims not only to restore the patients from their previous state but also to make them stronger from before their injuries. So, we welcome you, ma'am. Yes, ma'am. Ma'am, would you like to introduce yourself or say anything before we start the live? That's fantastic, ma'am.
Yes, yes. Tell me. So,
Okay.
anything that Vibha you want to address to the our physiotherapist that you know you can keep asking me few of the I can start.
Yes,
Uh,
ma'am. There are few questions like I got some DMs and even I am curious to know about. So I would like to ask you that what is the basic difference between aquatic physiotherapy and land-based rehab? So if you could
Yeah,
go ahead.
so there are obviously the land-based therapy, which is a conventional physiotherapy that we generally everyone of us do that. But with the natural properties of water, we use aquatic therapy as one of the newer rehabilitation, right?
Okay.
So can you tell me like the natural properties is like how it's buoyancy, right? The hydrostatic pressure. We
Buoyancy with the help of
Yes,
buoyancy.
buoyancy. And definitely we reduce the stress on the joints. That's
Yes,
how we
yes.
really help the patient to do a better rehabilitation, to encourage the motivation in them when it comes to a stroke rehabilitations and all, right? So with these and when it comes to an aquatherapy, it is always a temperature controlled water. It's a warm water pool. So that really helps to reduce the spasms, spasticity in the joints, and that's how we really in the muscles actually. So and with the natural resistance of the water, the strengthening of the muscles is very effectively done. So that's how we see that. But I never say that we should stop land therapy and only do aquatherapy. It's a combination of the therapies that we generally look forward. Is there some technical glitch? Yeah. Is it fine now?
Yes,
Yeah.
yes.
Yeah. So we never say that only aquatherapy works. It's always a combination of the therapy which gives beautiful results.
Ma'am, actually, your voice is not audible.
Okay. Just give me a moment. Okay. Am I audible now?
Yes, yes.
Yeah. Okay. So And whenever it comes to a land therapy, it's little high impact activities, which we see that initially we can use aquatherapy as one of the rehabilitation and then switch over the patient on the land therapy,
Okay.
right?
Yeah, yeah. That's great, ma'am. Actually, it's growing and its scope will also increase hopefully in future. So, can you give a brief overview of its growing scope and its benefits, we can say, so that people will
Uh,
get yeah.
Yeah, so see, definitely it's more westernized when aquatherapy from ages the people are using in the Western countries, right? There were few onsen baths in Japan. There were hot water springs initially, where people used to go and the arthritic patients, and they used to feel really better after once they are, using those kind of hot water springs. So the entire concept came from there, where water we use as one of the very effective way of exercises.
Okay.
Once you are in the water, we offload the weight on the joints. So
Right.
whenever it comes to knee pain, back pains, even with the shoulder injuries, which is a very chronic injuries, water really facilitates a good form of exercises in them, and reduces the pain, and it's quite, a fun way of exercises also, right? It's not
Yes.
quite monotonous. When I'm sure, like when there are patients for with us on a land therapy, and it becomes a little monotonous.
Okay. Yeah.
For an example, if I say when you go in a swimming pool or maybe some waterfalls, it's so rejuvenating itself. So water itself is a lot of a healing material. It has a lot of healing properties in itself. So the patient doesn't get too bored, or maybe it's a fun way of exercises in the water. And I mean, most of the
It will keep
people.
patient engaged, right? Like in different activities he's doing.
Yeah. And most of the patients, always look for a non-invasive treatments. If suppose if you will say like our parents or mom or anyone, if they start with a knee pain and gradually they want to have to go for a knee replacements, then they are little reluctant, because India is a culture like that. They immediately never want to go for something which is, unless and until which is very much needed. So the non-invasive treatment, what we look initially, if we start in a grade one, grade two, pain with the knee pain, for an example. So then we can see to it that we can strengthen their muscles very effectively in the water. And then, transfer them on the land exercises, which becomes, very easier for them to exercise on the, rehabilitate them on the land. So that's
Okay.
why it's more engaging, it's more effective, and there are many benefits of it actually.
Thank you, ma'am. This was something I'm sure most of us were not aware कि इसके इतने भी फायदे हो सकते हैं. But through this, many of us will
Yeah.
come to know.
Yeah, and I obviously definitely tell the crowd that in case with a grade one, grade two pain, also swimming is one of the best form of exercises, right? It's a say. I mean, so we see to it that we use water as one of the form of exercises along with our land physiotherapy.
Okay, combination of both of them.
Yes, 100%.
Okay, okay. That's great.
Yeah. Anything else you
Ma'am,
want to?
how yeah, ma'am, how do you assess the patients and integrate aquatherapy into it?
See, the assessment, obviously, it's a traditional way that we start with the detailed medical history. Without the
Okay.
medical history, I would say that every patient is not an aquatherapy patient. We have to do a thorough assessment with it. There are few physical limitations of the patients. We have to see the goals of the patient, right? As a physiotherapist, we always do a functional test on the land with any of the conditions. And similarly, we move them in the water and see their a few movements in the water. And after that, depending on the condition, there is a detailed assessment which has to be taken, taken, beforehand, and after that it's a personalized aquatic therapy program that has to be designed. So
Okay.
every individual has its own physical limitation, as well as the goals of every individual in respect to the therapy is different. So we always have to see कि पहले एक बार तो हमें a personalized detailed program has to be done, rather than taking any of the group therapy or something. It is always to take care of individual therapy programs, which is very effective,
Yes, ma'am.
right?
That's true.
Yeah, it's very
Yes.
important. And with this, when we take the patients in the water, because of the buoyancy, we reduce the pain, pain and pressure. I mean, and with the resistance, we start strengthening the muscles at the better level.
Okay. So ma'am, like if we compare conventional therapy and aqua therapy, ज़्यादा जल्दी recovery किस में हमें देखने मिलती है? मतलब अगर
See,
दोनों में देखें.
I don't say, because I was always a practicing conventional therapist first and then became an aquatic physiotherapist. So I give equal importance to both the therapies. But yes, a combination of the therapy works very good. But yeah,
Okay.
aquatherapy, I can say it's an add-on rehabilitation program which gives faster results on the land. I can frame it that way, that it gives faster results on the land. That is why we are using aquatherapy as one of the rehabilitation protocols.
That's awesome, ma'am.
Yeah.
काफी लोगों को और भी चीजें क्लियर हो गई होंगी बिकॉज लाइक हम लोग ने सिर्फ थियोरिटिकली पढ़ी थी बट आई थिंक देयर आर वेरी लेस क्लिनिक्स इन मुंबई इटसेल्फ जो एक्वा थेरेपी प्रैक्टिस करते हो एंड आई एम वेरी ग्लैड दैट वी आर हैविंग यू.
Yeah, yeah. Thank you so much. It's my pleasure as well. And secondly, there are not many aquatic therapy centers actually around. So that is why I really insist a third year. You're in a third year student, right?
Final year.
You're a final year. So I really tell, I mean, all the colleges, and so start using one of the lecture. I mean, one of the subject for as in hydrotherapy. We have always learned in the books, but practically we have never seen or experienced ourselves that how hydrotherapy is very effective. So I still see that if we can put one of the subject of a hydrotherapy, it will be great and great. And India, it's developing with aquatherapy. So
Yes, ma'am. It will be very beneficial to like
it
all of
will be,
spinal
yeah,
physios and for everyone.
yes, 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 100%.
Ma'am, may I know the conditions, like how many types or what all types of conditions are treatable with the use of aqua therapy?
See, I mean, conditions when it comes to aquatherapy, we can start with a very young age with the developmental disabilities, the pediatric patients, basically, right? The developmental disabilities like autism, cerebral palsy, DMDs, BMDs, Frederick ataxia. These kind of patients can give beautiful results with aquatherapy. I can say these are all progressive disorders, right? So we
Yeah.
see to it that we help them to delay the progression,
Okay.
right? Then it comes to ortho cases like knee pain, back pains, and fibromyalgia. When you say cervical issues, frozen shoulders, it also gives very good results. Uh, like we generally, when it comes to aquatherapy, the part to be treated has to be immersed in the water. I mean, if we are
Yes.
treating a frozen shoulder, like we can't keep the water level to the chest level. The shoulder has to be immersed in the water to get its effectivity. These are the basic principles of the water. So that's how we start treating with the different conditions. Especially the very good results we see in the neuro rehabilitation, the stroke cases,
Okay. Wow.
right? Why stroke cases? If you can just highlight few. Obviously, you are a final year student, so can you tell me that the tone is flaccid, right? Initially,
This acid
they are quite demotivated patients because they lose the hope that अभी वो recover हो पाएंगे. They can walk like a normal people on the land. So when we start taking them in the water, they are they reduce the weight. Their body weight is reduced when they are in the water. So the movements for them is much more easier in the water.
Oh, hmm.
So then they feel that confidence gaining back, that I'm easily able to do activities in the water nicely,
They will be
which inner
motivated
they
by
when
themselves.
motivated when they do their land therapies. So how the protocol goes is that we take 3 days of aquatherapy in a week, and then rest 3 days when they are not doing aquatherapy, we take land therapy. So that
Okay,
combination, the combination of the results gives, it's amazing. It's very effective.
fantastic, ma'am. Okay.
Yeah.
It will also reduce therapist work, no? Like if we continuously go in conventional therapy and the patients are hefty, so it ultimately increases therapist load. But with the help of aqua therapy,
Yeah.
it will reduce.
Yeah, it reduces the pressure on the joints, and that's how it's more effective. And um, you can say a lot of arthritic cases,
Okay,
a lot of angst cases. Yeah, we
okay.
have always heard, heard in our curriculum that with the angst and such kind of conditions, swimming is one of the best form of exercises, right?
Yes, ma'am.
We generally advise a lot of patients that yeah, you should keep going for the swimming. So that's how, because it's an overall body workout, and it really helps them to gain better mobility. That
Okay.
reduces the stiffness of in the joints also.
Yes, ma'am. So, ma'am,
So
it doesn't
such
have any age barriers. Like,
sorry.
it doesn't have any age barriers कि ये particular age के बाद there is a risk or we tend to avoid.
See, in terms when it comes to aquatic therapy, it's a very low impact activities. Even if the
Okay.
patient is osteoporotic, or with a lot osteopenia is there, we see to it that I told you, because it's in personalized attention to every patient. We can always monitor this kind of conditions 101, and we can see to it. That with aquatherapy, it's never injurious. I mean, it's
Okay.
never injurious or hazardous when it comes to aquatherapy, because there is no, it's a low impact activity. That is why.
That's great, ma'am.
Yeah.
Okay. Ma'am, and what all innovative techniques do you use? Like I've seen treadmill training are being used for training patients in gait training and for
Yeah.
strengthening. So could you share what all innovative techniques do you use?
Yeah. So see, when it comes to aquatic therapy, I want to start and I want to address to my physiotherapist that to my growing physiotherapist that the techniques what we use in aquatherapy is also a very on a scientific basis. When we say it's called Halivic techniques, we use water specific therapy, we use Aichi. These are the different names of techniques that we use. There is called as a Badraga's ring method. So when
Okay.
you want to upgrade yourselves into as an aquatic physiotherapist, you need to undergo some kind of courses or workshops wherein you get these exposure to these kind of know these kind of techniques. Because when when being an aquatic therapist, being a physiotherapist, we just don't go in the water and just exercise. There are many technical things that we use in the water.
Okay. Right.
And when it comes to aquatic therapy, when it comes to aqua treadmill, when you say, yeah, it's more engaging, because and it's very innovative, right? I mean, many people have not even heard about aqua treadmill.
Yes, ma'am.
So it's quite fascinating for the patients, or maybe even can say the physios also, to know, because there is less impact and it's a graded. I mean, we can grade the speed in which we can make the patients, so there is always uh, interactive sessions with them.
Hmm.
It's quite
Yes.
engaging. It improves the patient's motivation also.
Yes,
And
yes.
secondly, you see, it also helps them to gain a lot of balance and coordination in the water.
Right, right, right.
You Because when you are in the water, we are surrounded with the water from all the sides.
Yes, yes. Okay.
Right, so there are multiple activities that we can use in the water.
Yes. Ma'am, I've heard that virtual reality, it has also been practiced in aquatherapy. So, is it practiced?
It is practiced, not too much in India because we always believe in our hand skills and everything. But yeah, virtual reality is mostly used for aqua fitness,
Okay.
the patients who are highly obese. And when for them, I mean, going to the gym or going to any of the kind of activities, they are not very comfortable, or the muscle soreness is on a very higher side. At that times there are group sessions, with aqua fitness, that they usually go, and there we have like a lot of virtual reality things where it's quite interactive, quite motivating for the patients. They keep pushing the patients, okay, now you do this, that, and quite engaging for them so that they don't get bored or leave the sessions in between. Like as in the gym, they do few movements and then once they are tired, they leave off the sessions, right? So
Okay.
that's how virtual reality is growing now.
Okay.
Not great in India, but yeah, it's on a growing sector.
Okay. So we must say that in coming future, aquatherapy will be in very much demand. कि सबको ये ज़्यादा fascinating लगेगा
Yeah,
in coming
it's
future.
already in demand, I could say. That's why
Okay.
many physiotherapists, once they are completing their bachelors, they want to, upgrade themselves into an aquatic physiotherapist because the results are good. Variety of the patients. I mean, there are variety of the conditions that we take in the water. There are no limitations as such, right?
Yes, yes.
Yeah, with starting with a disability, developmental delays, uh, with the pediatric rehabilitations, when it comes to ortho, neuro, sports. Again, we can take uh, fitness. Aqua fitness is one of the thing that we can really help the patient to lose weight also in the water. So it's a broader spectrum altogether. So that's how
Correct.
the demand is on a very higher level. We just have to see that we make enough centers so that our physios can start practicing with aquatherapy.
Yes, ma'am. That's fantastic.
Yeah.
Ma'am, like as the demand is increasing, is it financially feasible for every patient? Uh,
uh, See, I mean, what has happened is that definitely, when it comes to aquatherapy, there is some cost which is involved because it's a temperature controlled pool, and you require a bigger area to establish the entire setup and everything. But as the growing need in India is, there's a lot of growing need. The insurance companies have come up, which also see to it that they reimburse them for the patients. And secondly, when you will see, it is more effective. In a shorter span of time, we are able to give very good results to the patients. So that's where the demand is also growing on a very high. And when it comes to a cost, since we are able to give them good results, it's quite sustainable, and we can see to it that we can incur the cost of aquatherapy. I mean, the investment can be easily taken out. So I don't see any challenges that it's too highly priced or something. We
it's
can
moderate.
definitely,
Uh,
yeah, yeah, yeah.
that's great, ma'am. Ma'am, would you like to share any case studies or any patients like recovery? Uh, how did the patient was first and with the help of aquatherapy is now properly fit or back to his work? your experiences?
Yeah, so there are many cases now. Since we are the Aquamax was situated, I mean, came under the thing in September 21, and since
Oh,
then we have been treating many cases. But yeah, one of the cases which I want to address was. From Kokilaben, from Dr. Padiwala sir's case, and it was an you. That's very common, right? The ACL injuries,
yeah,
the
yeah.
ACL tear and MCL and all. So the ACL, she was a skier and she had a fall and it was a tear. But the doctor advised that you do prior prehab physiotherapy, right? There is a concept called as a prehab before the surgery. You go for a prehab aquatic therapy, then we will wait for 2 months and then we will see how is the progress. And she we started with the therapies and she was a very active and a dedicated patient. So she did aquatherapy along with a nice land strengthening exercises and everything. I mean, she was very dedicated, and we could see within the 3 months the MRI was done, and the doctors told that there is no surgery which is required post
Wow,
aquatherapy. So that's
fantastic.
a great success story for all of us. I mean, as a newer innovation in the aquatic therapy, so we should make a most use of it,
Correct.
right? We
And
should
it's
make a
very
most
inspiring,
use
man.
of it.
कि
Sorry.
surgery से it's very inspiring to see कि if we are preventing someone surgery से, like there's no need for surgery just because of our rehabilitation. It's very inspiring.
Yes. So it's very inspiring for us as a physiotherapist that we are able to help the patients and to recover well and avoid the surgeries actually. Because it was a grade 1, grade 2 tear, it was not a full blown tear. So we could see to it that we can give best of the results in that.
Yes, ma'am.
Especially, post COVID, a lot of avian cases have been came across. If you are aware about it, I'm not sure. So, a lot of
Uh,
avascular necrosis cases have been we have come across, and those cases are also, when they start the prehab, when they start using aquatherapy, even if they go for a surgery, the post-op is so easier for them to recover, and we are able to see very good results in AVN cases also. And
that's
I
fantastic.
want to highlight that the stroke patients gives tremendous, amazing results when it comes to an aquatherapy rehabilitation. I could see,
Okay.
and it's not that it has to be really acute. Even if it is a chronic case, even if you are a stroke case from 2 years or 3 years, and then you come for an aquatherapy, still we are able to give them better results.
Okay.
Yeah,
That's fantastic.
yeah,
It's awesome. Okay, ma'am. So I think all the questions have been covered and you have explained it very amazingly. Like बहुत अच्छे से explain किया and we have cleared our doubts. क्योंकि काफी डाउट्स
yeah,
थे पहले में कुछ काम लाइक कितना यूजफुल है कि कौन से स्टेज तक बट फ्रॉम ऑल द ग्रेडिंग्स यू हैव एक्सप्लेन्ड इट इन अ वेरी awesome manner, I would say.
yeah. Thank you so much. And we are always just a call away, or if anyone has any doubts, I mean, in respect to aquatherapy, or they want to learn aquatherapy, or any other doubts if they have, we are just a call away. You can always message us, or you can through Vibha also. We are always there to help you out. Yeah. So through Vibha also, we are always there to help you, and we can always address your concerns.
If any doubts, if anyone is having, they can put them in the comment section or after the live ends, you can also DM ma'am on Instagram. I will put their like link in my description box so that everyone could check it out. And yes, we are open to all your doubts. You can mention in this video also. And yes, thank you so much,
Yes.
ma'am. Thank you for your
And
time.
I would sincerely thank Vibha. So she is taking such a great initiative to create this awareness. I'm glad, Vibha, and I always look forward to do such kind of activities further also with you.
Yes मैम बिकॉज
Okay.
फिजियोथेरेपी का पहले से अवेयरनेस कम है लाइक इंडिया में सो आई जस्ट वांट टू क्रिएट अवेयरनेस अमॉन्ग द पीपल कि यस इससे एक्चुअली फर्क पड़ता है.
Yes, इससे बहुत फर्क पड़ता है and I'm glad that Vibha is taking this initiative and we are able to know more about aquatic physiotherapy. So thank you so much, Vibha. And in case if there is there are there any queries, we look forward and we are here to clear your doubts.
Yes मैम.
Yeah.
थैंक यू फॉर जॉइनिंग.
Thank you, Vibha. Thank you for having us.
ओके मैम. बाय.
Okay. Yeah. Thanks. Bye.